Nakakagulat eh.
Kabog.
Us. I am Dr. Ana York Bondoc. Good afternoon po. And thank you for joining us today. Tayo po ay live on Facebook and on YouTube and we're inviting you po to join us. Ang ganda po ng topic natin which is face shields, kailangan pa ba? Okay? So, please join us. We are live on YouTube. Please like and subscribe. We now have 500 subscribers. 500 more na lang po and we have made a big step sa aming YouTube. Please do follow, subscribe. And sana po makinig kayo sa bawat YouTube namin. You're also welcome to follow us on Facebook. Ilagay lang po yung mga tanong sa baba. Sa mga bago po, my name is Dr. Ana York Bondoc. I am an intensive care specialist and a pulmonologist. That's a lung specialist. Ako po rin ay isang espesyalista in internal medicine. I am a psychologist by training, the wife of Mayor J, a former congresswoman, and the mom of an 8-year-old child named Benji. At ako po ay nandito ngayon sa San Luis, Pampanga. Willing to answer your questions kung face shields, kailangan pa ba? So let's start and tingnan po natin. Ang formula po natin ngayon or the format that we will choose is to comment po on various statements na narinig po natin about face shields. Okay? So saan po ba nanggaling itong issue na face shields kailangan pa ba? Last week, kung napansin niyo po yung inyong Facebook feed, parang ang dami hong nagpo-post, kailangan pa ba ng face shield? And one of those to post very prominently was Manila Mayor Isko Moreno or popularly known as Yorme. Sumagot naman ho yung mga grupo ng mga doktor na yes, kailangan pa po ng face shields. So let's discuss the issue po and tingnan po natin yung both sides at tingnan po natin kung kailangan pa po ba talaga ang face shields. Okay? So let's go with statement number 1. Ano nga po ba yon na parati po nating naririnig? So, Ms. Reyna? Ano po ang statement number 1? Ayan, para makapag-comment tayo.
Our first statement po, face shield ay hindi nakakatulong kontra COVID.
Napakagandang ano po ito, no? And something that we hear all the time, so napakagandang pag-usapan. Nakakatulong pa ba kontra COVID ang face shields? Okay. Issue number 1, ito talaga. Kasi effectivity naman talaga ang number 1 na tanong ng tao. So ito po, may datos po talaga. There is really real world data that social distancing, 90%, masks, 90%. Pero wala po talaga tayong data on that initial na face shields at combining the mask, the face shield, and the social distancing. Pero recently, nung nagka-search po sa India, there was a study of 62 Indian healthcare workers. Now, yung mga healthcare workers po ay umikot po sa India. They were taking information about patients. And nung wala po silang sinuot na face shield, they were just wearing a face mask. Marami po, there was a significant number po na na-COVID sa kanila. Nung linagyan po sila ng face shield and face mask, umikot na naman po sila and talaga pong nakita that none of the healthcare workers developed COVID. So there is real world data, hindi lang po sa laboratory. So yes, may datos. Number 2, it happened in India. And number 3, face mask plus face shield. Okay? So nakakatulong po kontra COVID ang face shield. So the next question is bakit? Kasi po, it is an extra layer of protection. nung tumaas po yung surge ng COVID in the United States, si Dr. Anthony Fauci po even suggested double face masking. Kasi po, most of the people are using cloth masks and alam po natin na talagang the level of protection of of cloth mask is good pero hindi pa po siya 100%, malayo pa po actually. So there was a suggestion po to use surgical mask plus cloth mask or two cloth masks. Sa Pilipinas po, despite the surge in April, hindi na po tayo nag-recommend ng dalawang cloth mask, even though majority of Filipinos do wear cloth masks, kasi po we have already a double layer of protection, which is the cloth mask and the face shield. So, dalawa po yung layers. And yung theory po natin ng layers of protection, kaya po kasi nagiging layers, sabi po nila, patong-patong po yan. No layer is 100% perfect. Pero when we use it together, and we layer them, yung butas po na isang degree of protection, nakukuha po ng kabila. So, that is the second layer of protection. Or actually, the third, because the first layer of protection is really social distancing. The second layer of protection is your cloth mask. And the third layer of protection po talaga is your face shield. And another issue po sa face shield, the face shield protects your eyes. It has been proven na pag yung kamay nyo po, talagang maraming hinahawakan and you touch your face, malaki po talaga yung probability na kayo po ay magkakaroon ng infection. And actually, it does not only protect against COVID. Marami pong respiratory infections na bumaba po ang kanilang frequency. Like for example, the flu. Kumonti po talaga nagkaroon ng flu because people were protecting their nose, their mouth, and their eyes. And so, their level for protection was higher. So, they didn't get COVID and they also did not get the flu. So, yes, kontra COVID po talaga ang face shields. And not only kontra COVID, but kontra iba pang mga respiratory infections.
Letter B. Pilipinas lang ang nag-require ng face shield.
Marami rin hong nagsasabi niyan. Well, the Philippines is not the only country in the world to require face shields. Ang Peru po is also using face shields. And in the United States, again, face shields is a recommendation. Alam po natin na magulo po ang sitwasyon sa Amerika. Lots of people don't even want to wear masks, okay? So talagang it is a layer of protection pa po and it is recommended by the CDC. It is a recommendation. Hindi lang po sila sa US makapagmandato dahil magulo po yung kanilang society ngayon at pati mask lang ho ay question niya. So the Philippines is not the only country in the world to require face shields.
Letter C. Mainit ang mag-face shields.
Well, talagang honestly, totoo po ito. It is really quite hot, no? Aminado na po tayo, it being summer, it was summer, well, beginning na po tayo ng rainy season, thank God. Pero talagang mainit po talagang face shield because it really blocks the air in front of your face. Hindi ko po makokontra ito. It is really quite hot. Ako personally, I travel po na may pamaypay para at least mapaypay kung palabas yung COVID. And some people do walk around with miniature electric fans. So, mainit po talaga ang face shields.
Letter D. Makalat at magastos ang plastic ng face shields. Hindi ito nare-recycle.
Well, may point rin po naman talaga because it is made of plastic. At yung plastic na yon, talagang, it is plastic. Okay, it's not recyclable. Ang masasabi ko lang talaga dito is, try to preserve na lang the use of your face shield. Ako po, kahit scratch na po yung face shield ko, I still do use it. So again, just try to do your best po na to use one face shield. Pero again, kung masasagasaan naman ho kayo, wala na kayong makita sa face shield, then we have no choice but to buy another face shield.
Letter E. Sa labas o outdoors, hindi kailangan ng face shields, especially when doing outdoor activities like exercise.
This is probably one of the best points po versus face shield, okay? And ano talaga ako, aminado din ako, outdoors po talaga, especially where you live. If you live in the province, if you live in a place na talagang wala ka namang katabi. If you live in a place, for example, magsasaka ka, no need naman to use face shield. No need na rin, I would wear a mask kung magkakaroon ako ng kasama, no? And just pull up the mask. Pero kung mag-isa ka naman lang, then really there is no need for a face shield. And the face shield talaga would be the best po in the following situations. Number 1, indoors. Pag talagang indoors po kayo at walang ventilation po yung inyong opisina, then you really have to wear mask and face shield kahit 8 hours a day po, isusuot nyo yon because that is for your own safety. Okay? Indoors also, entering po a mall, maraming tao, density po talaga. Yan ang tinatawag pong dense. Magkakatabi po yung mga tao. Then I would really suggest, at kayo ho, kakabahan na rin kayo kung marami kayong katabi, you will get the face shield that you're having na nakalagay dito sa ulo nyo at ibababa nyo talaga yan. Okay? Sa mga malls, crowded areas, indoors talaga, no questions asked, kailangan po talaga ng face shield. Hindi lang kailangan ng face mask, ikaw mismo ang magsusuot ng face shield. Ngayon, another activity outdoors na medyo questionable sa akin is riding public transport. When we ride public transport po talaga, dikit-dikitan talaga yan, lalo na po kung umuulan. There is no way po talaga na magkakaroon po na social distancing doon. I would highly suggest po to habang nakahintay po ng bus, habang nakahintay po ng FX, waiting po for public transport for the MRT, you have to wear your face shield. Ngayon, walking around, wala namang katabi, talagang honestly, I would say, no, it really depends on the situation. Talagang the IATF, minandato na lang kasi, talagang hirap naman kasing ihiwalay, no? Outdoors, I would say, tansyahin nyo po yung sitwasyon. Kung talagang hindi na po kayo makahinga, it's really terrible. Itaas nyo muna yung face shield nyo. Tingnan nyo kung sino mang katabi nyo. Kung wala naman, you can breathe, okay? However, kung kayo po ay in public transport, outdoors, with a lot of people outdoors, nakapila po outdoors, talagang isuot nyo po yung face shield na yan. Indoors, no questions asked, lalo na po pag walang nakabukas na bintana and you're in an aircon place, face shield ang kailangan nyo. Because remember, added protection pa rin po yung face shield. If you are outdoors, di kayo makahinga, take it off for a while, tumabi muna kayo, take a deep breath, relax muna. Wala ka namang katabi, then that's fine. The IATF has mandated it indoors and outdoors kasi ang hirap po talaga is separate. Pero ako po naman, I'm being a realistic person. Kung talagang magiging palaban naman ho kayo, just ang mga tao naman ho talaga they will bring a face shield kasi they don't know kung kailan sila papasok sa mall, kailan sila papasok sa fast food, kailan sila papasok sa CR. So most people tend to wear their face shield on their head. Tapos binababa na lang po pag kailangan. So yun po, that's what I could say. The face shield is necessary. I could say na wag muna siyang tanggalin kahit na bakunado po kayo kasi it gives the wrong impression to people na okay na. Baka hindi lang face shield ang tanggalin, baka face mask. But our conclusion, kailangan pa rin ang face shields, especially when indoors, in crowded situations, pag maraming tao, at kulang po ang ventilation. Kung ayaw nyo pong mag-face shield, my last conclusion, kung ayaw nyo pong mag-face shield, init na po kayo, hirap na po kayo, isa lang ang solusyon doon. Huwag pong umapela sa IATF na tanggalin ang face shield. Ang dapat pang solusyon doon ay magpabakuna na po at hikayatin po lahat ng inyong kaibigan, kasambahay, katrabaho na magpabakuna para tanggalin na po ang face shield at ang face mask. So, yun po yun and magandang hapon po sa inyong lahat. So, I think we have a few pictures prepared para makapag-comment po tayo about the situation and whether we needed face shields or not. Okay. Pwede pong lakihan yung photo. It's very small. If possible lang po, no? Ayan. What happened here? Kasama ko po si Dr. Alfonso Danac, the Chief of Clinics po of the Jose B. Lingad Memorial Medical Center. Kababakuna ko lang po and we are very happy posing with thumbs up. Naka-face shield po kami dito because we are indoors. Again, that's a hospital, Jose B. Lingad. COVID hospital po yan, so you really need to wear your face shield. Naka-aircon po kami, nasa loob at medyo maraming tao. So yes, face shield po sa sitwasyon na to. Dalawa po kaming doktor. I think Dr. Fons is even wearing an N95. Okay? Ayan, pakilakayan na lang po. Ayan, nakikita niyo po sa likod ko, that is the City of Dreams. So yes, pumunta po kami ng City of Dreams para umikot-ikot lang ho to bring Benji around. And again, that is a hotel, a public place. So So, naka-face shield po ako and face mask. Take note, outdoors po yan, ha? But I'm still wearing a face shield and a face mask. Because I'm in a hotel. Ayan, naka-swimsuit po ako. Ang kapal na mukha talaga ng mga tao may edad na naka-swimsuit. But whatever. Masaya kami. So, I am wearing a face mask and a face shield po dito because to walk through the hotel and to go to the swimming pool, marami po kami ma-encounter na tao. So, I only remove the face mask and the face shield just before swimming and talagang socially distanced din po yan. So, this is the only occasion I think that you can see someone wearing a swimsuit, a face mask, and a face shield. Ayan. Nagninang po ako sa simbahan po ng Bahay Pari Candaba. I am wearing lulutan gown. That is a designer gown. And I am wearing a face shield and a face mask. So kung kayo po ay attending a religious occasion, becoming a ninong or a ninang, marami rin po kayong mga katabing tao. Again, face shield and face mask. Ayan, ang ganda naman. The ninong, my kumpare and me are walking down the aisle. Both of us are wearing face mask and face shield. Nakita nyo naman po yung mga, these are Coast Guard and nakakawak po sila ng sword. They are also wearing face mask and face shield. So yan po talagang tama. During occasions, sa weddings, kailangan po talaga. Pwede ba i-close up yung dating ko? I am the only ninang wearing a face shield and a face mask. Kahit po picture taking, ayoko kong tanggalin yung aking face shield and face mask. And yan po talaga ang tama po. No? And this is just a happy mask na ginawa po ng aming anak. That's Benji wearing a mask. Cute lang po. Okay? Ito, nasa palengke po ako, I am not wearing a face shield. Yung dalawa kong kasama ko are posing with me. Siguro po they really wanted to, I promise they were wearing a mask like 5 seconds before the photo was taken. Ito lang outdoors po itong palengking to. Again, in the province, so mababa lang po yung COVID rate. But again, it's really better po talaga in this situation if I had worn a face mask and a face shield. So, sa mga palengke po, even if it's outdoors, please don't follow me. Though sa palengke yan, okay na po talaga. Ay sa province, mababa rin po naman. If you were going to the palengke kahit po open air, I would suggest face shield and face mask. Okay? So sa inyo po lahat, if you would like na matapos na itong face shield kwento at matapos na rin po itong face mask, magpabakuna po tayong lahat.
From one of our viewers, yung mga bakunado ba, kailangan pa rin ba ng face shields?
Well, this is a very good question, Reina. And we are moving towards this. In the US, those who are vaccinated no longer need both face shields and face masks. And mag-move tayo towards that. Kaya lang, they have vaccinated a large portion of their population. Also in the UK, they are moving towards that kasi talagang aabot ata sila ng herd immunity, which is 70%, both in the United States, in the United Kingdom. So sa Pilipinas, we are going to be moving towards that. Right now, 5 million pa lang ang nababakunahan natin. So wala pa tayo doon. Pero pag dumami na po ng dumami, and I think there are almost 10 million vaccines arriving at the end of June, Reina, pag talagang maganda uptake ng mga tao, talagang magmamandato na rin ng IATF na tanggalin not only the face shield, but also the face mask.
From Mizari Cruz Larin, yung inubo po na may kasamang konting dugo ang plema, bakit po?
Let's go muna to the face shield and face mask issue and then balikan natin si Zari.
From one of our viewers, how about when exercising?
Alam mo, napakahirap talaga nito, no? But where are you exercising? Kasi I can't just imagine jogging, but I guess it will happen talaga, no? Where are you exercising? Okay, kung nasa bahay ka lang, wag na. Face mask and face shield tanggalin. Okay, you're in your house. But if you happen to be, I think some of the gyms are still closed Kasi talagang close contact talaga yon. Ventilated, not ventilated yung area. Humihingal yung mga tao so they are breathing forcefully. And parang mahirap ata maisip na kailangan mag-face shield sa panahon na yon, but definitely, a gym could be a super spreader area. So if I were to enter a gym, kung papabayaan na po na IITF yung gym na magbukas, I would wear a face shield and a face mask. So the best place po to exercise is outside of your house and outside of the gym. So kung kayo po ay nagja-jogging sa daan, siguro po, I mean, lalo na wala naman kayong katabi, you can put the face mask down, wala naman, and then jog. Pag may nagtatao, iakyat, baba yung face shield. Okay? Just being realistic. If you are indoors, I don't care kung nagbubuhat kayo, nagzuzumba or what, you need to wear a face mask and a face shield.
From one of our viewers, bakit sa TV naka-face shield si Vice Ganda na walang mask?
Alam mo, maganda yan kasi nagulat ako, I was watching and then lots of people are wearing pala face shield without mask. Well, ideally, if you were to remove something, it would be the face shield. Kasi parang mas complete sa akin lang yung mask, ano? But definitely, may layer of protection pa rin. Kaya lang, I guess they just really have to talk on TV. I'm hoping talaga, maraming yan, na-PCR yan araw-araw. Okay?
Okay, from another viewer, how about yung may glasses o salamin? Baka magasgasan.
Alam mo, totoo yan. We just really have to, tiisin na lang ho natin na by the end of the year, wala nang face mask and face shield. Worse, baka masagasaan. Please, when crossing the road, lalo na po kung malakas ang ulan, be very cautious po because baka naman ho kayo masagasaan. Okay, are those our questions for the face shield? Is Ms. Zari's question ready? Wala bang bumabate?
Wala naman po masyado. Okay, is this the question na, Ms. Kat? Okay, I'm just gonna read it, Doc. From Mizari Cruz Larin, kung inubo po na may kasamang konting dugo, ang plema, bakit po?
Possibility number 1 po, may infection lang. The infection po damages the lungs, the lining, and sometimes the blood vessels. So pag ubo, may konting bahid ng dugo. Number 2 possibility, TB. Same reason, kinain po ng TB yung blood vessels sa baga, and now it's spraying a little blood. Third possibility, lung cancer. If someone is a smoker po, and talagang, sa tawag namin dito is hemoptysis eh. Hemoptysis. That is the technical term po for may dugo po sa dura. If someone is a smoker na may dumudurang dugo po biglaan na talagang walang infection and walang TB, I would work up that person for lung cancer.
From Mizari Cruz Larin, kung nabakunahan na po at nagka-COVID, kailangan pa po bang mag-quarantine? Bakit?
Yes. Definitely kailangan po. Because once you've been vaccinated po, even 2 times na po, ang nakalagay po doon is no vaccine is 100%. And ang 90% po talaga doon is hindi po kayo mamamatay, mau-ospital o masiseryoso. But it is definitely possible to get COVID. It's also possible po na i-pass on yung COVID sa ibang tao. So yes, you need to be quarantined. If you are a close contact. Kasi po, baka po kayo makakawa ng tao.
From Mizari Cruz Larin, paano po malalaman na fake ang face mask na gamit?
Well, try to examine it naman. Kung maraming layers naman po, likely hindi naman po fake. Hindi naman siya branded eh. And I'm hoping naman na kahit paano may standards naman po. And again, any face mask is better than no face mask at all.
From Ms. Leonida Calixtro Dacles, Doktora, consider ba nasa comorbidities ako? Senior na may mataas ang cholesterol, may osteoarthritis, low blood, mababa hemoglobin.
Ma'am, just by being a senior, you're already in the A1 category. So tuloy na po doon. Sorry, A2 category po ang senior. Go na po. Pabakuna na po, ma'am.
Promise
A2 po kayo. And sa San Juan, they're already starting A4. So please go na. Panahon nyo na po talaga, ma'am.
From Ms. Mayeto El Buenacosa, Dok, kailangan ba magsuot ng face shield pag naka-eyeglasses na?
Yes, actually, that's a good question. My original answer would be, in practicality po, in practicality, the answer is actually no. Hindi na kailangan eh. Pero the IATF, parang ang hirap naman kasi natitigan yung mukha ng bawat tao at titingnan kung may glasses sila o hindi. So parang minandato na lang nila for everyone. But in theory po, your eyeglasses do protect you from from um, from touching your eyes. Pero due to the IATF ruling, you do have to use it. I'm sorry po.
From Miss Patricia Uhano, Doc, kahit vaccinated na ay nagmamask pa din kami dito sa US.
Ay, thank you, ma'am. That is really the best. And I would do that if I were you. Tama po yan. Kasi hindi mo naman alam sa US, ito lang nga, and this is what I don't, what may concerns kasi ako, nakalagay doon, if you are fully vaccinated, then you cannot wear a mask. Kaya lang, ang tanong ko is, how do you know that you are fully vaccinated? Baka yung mga ayaw magpabakuna, worse, ayaw pang magmask. So talagang very dangerous po sila sa ibang tao, lalo na po for those who are receiving chemotherapy, those who aren't really, yung immune system po nila are not really, talagang may problema po sa immune system, they will be vulnerable despite their vaccinations from persons who are not wearing masks, who are not vaccinated. So, talagang gusto ko itong mask wearing kahit na bakunado for some time.
From Miss Sharon Pareño, Fabian, Doc Ana, pwede na ba to have a get-together if everyone is already fully vaccinated? And pwede na ba without mask?
Ma'am Sharon, Miss Sharon, I had a great discussion with Miss Sharon last Saturday about super spreader events. And when I came home to the province, I heard that there were some persons who also got sick due to talagang family events na may nangyari talagang nag-positive ang isang tao doon at nakailatan po yung ibang tao. So, talagang worrisome, nagbibiruan kaming mga doktor kasi if there is one group of people na nabakunahan na po talaga, those would be doctors. So, feeling ko, kami ang dapat unang mag-reunion, but we still don't do it because we realize po the danger po to our families and friends. Siguro, when we reach a critical mass of persons, then that would be the ideal time to mandate that. And I think we will be reaching that also. Depende na lang po sa dami ng bakunan darating at sa uptake po ng mga tao. But at this point talaga, Ms. Sharon, ako fully vaccinated na rin. My brother is fully vaccinated. My friends are fully vaccinated. Pero I'm still very cautious about social gatherings. Cautious pa rin ako. I haven't eaten out pa despite being fully vaccinated. So darating din yung araw na yon and the government will advise us.
From Mizari Cruz Larin, lalo na kung may COVID ang inubo na may plema na may blood stain.
Normally, Ma'am Zari, hemoptysis or blood in the sputum is not a prominent sign of COVID. But it could happen. So kung talaga nawawala na ho kayo ng panlasa, then bigla kayong dumura ng konting dugo, dumiretso na rin ho kayo to have yourself isolated and quarantined.
From Mr. Carlo Bernardo de Leon, Doc, karamihan sa napapansin ko sa mga ordinaryong tao, madumi na ang face shield nila. Hindi ba magiging dahilan ito ng pagkahatsing?
Possible. Ang advice ko na lang, please clean your face shield na lang po before you leave the house. Iba naman ho yung madumi, iba naman ho yung na-scratch. Kasi yung na-scratch po, hindi naman dumi yun eh. Pero kung literal na dumi, linisin na po. Kasi totoo naman, nakaka-hatching po yun. I would say yes. I would agree with that.
From Mr. Arnel Reyes, Hi po, Doktora. Masarap po ba yung batute? Watching here at Cavite. Good PM po.
That's yan ang stuffed fried frog. Okay? Stuffed fried frog, betute. Yeah, it was pretty good. Yung husband ko po talaga is the one who eats frog more than us because lumaki po siya talaga sa bukid. Though when I was small, I do remember eating a frog soup. So only when I moved here again during the pandemic, kumain po ako ng stuffed fried frog or betute. Tugak po in Kapampangan yan, Do you know when is the best time to gather frogs, Reina?
I don't know, Doktora.
Most people, where do we buy the frog? Yun binigay ni Dr. J, ano? Pero we mostly buy frogs sa palengke ng Candaba. And kung umulan the night before, that's the time that people gather frogs and sell them. So this rainy season is actually a good time to eat frog. Mga recipe ng frog, adobong frog, prinitong frog, stuffed fried frog, at merong nagsabi sa akin, tinola, soup. Ay, by the way, si Benji kumain po ng tugak. Okay ba, Reina? You want to come here and eat?
Why not, Doc? Why not?
Yeah, it's something to try.
Yes.
Kat, you live in San Luis. Have you eaten frogs? Do you eat frogs? Anong kwento mo?
Yes, I already eat Paul nung bata pa po ako. Parang yun nga, yung tinola. Tinola and yung pinirito, adobo tas pinirito.
Yes, meron ganun. Okay, that's good to know.
Mm-hmm.
Here sa Manila, Doctor, it's not very common to see frogs sa palengke.
Nakakatakot naman kasi dyan, Reina. Okay, when they gather frogs in Metro Manila, you have no idea kung sa kanal nakuha, okay? Talaga. Kinain mo na ayoko na talaga. But
Tsaka
dito sa province, oo.
Tsaka may restaurant po kasi dito sa Pampanga na nagsiserve po sila ng frog.
Yes, meron. Diba? Everybody's. So dito, kinuha siya talaga sa bukid. So it wasn't eating garbage. It wasn't eating mga tinapon. It was really eating insects and yung mga nasa bukid, which is considered clean. Okay?
Yes. Dito naman, Doc, ang pinaka-famous na puntahan pagka gusto mo ng frog is sa Ongpin. Yan.
Oo, tama.
Doon.
Okay, kaya doon. Okay, parang nandito si Zari. Yes, Zari?
From Zari Cruz, Larin. Kapag na-COVID po, pwede na po bang agad magpa-vaccine? Kasi mga seniors pa lang inuuna daw po sa ilang lugar.
If you have that, there are cases like this. Merong na AstraZeneca, then na COVID. And then, the question is, when is the next AstraZeneca? Meron, in the beginning, it was 90 days. Pero ngayon, the advisory is, if you're feeling well, mga 1 week na po, wala na talaga nararamdaman, pwede na pong magpabakuna. Kasi the danger of waiting, may danger talaga of waiting and delay. So, as long as okay ka na, it's been a week, you can be vaccinated with a COVID vaccine if you have had COVID.
From Ms. Jane B. Bolus, Doktora, agree po ba kayo sa pagpabakuna ng mga bata?
This is something very interesting. And my classmates' kids, I've seen them being vaccinated po on Facebook. I would say po na, kasi sa dami na po nang nabakunahan na rin po na adults, parang ang dami na rin po nating nalaman. And again, this is another good thing na nalilate po yung Pilipinas. Kasi makikita po natin yung reaction po ng mga bata sa ibang bansa. Okay? So I would say my answer would be yes. But again, I would like to see muna more data and mauna naman po sa America at sa UK. So tingnan po natin kung ano mangyayari sa kanila. So theoretically, my answer would be yes. Ay, another point ha. Another point na maganda, which pinag-usapan po namin ng kaklase ko po, my best friend since elementary school. Some of the seniors in their family refuse to be vaccinated, okay? Unfortunately, na-radicalize po ng internet, naging anti-vaxxers po yung ibang miyembro po nilang pamilya nila. But there are some kids who they are very close to na mga 6 to 8 to 10 years old na mga bata who live in their house, okay? Sabi ko, one of the concerns of these seniors po na ayaw magpabakuna, and of course, we all know that they love their apos. Pag nag-umpisa na ang face-to-face classes, Reyna, etong mga batan to are going back to school. They cannot be vaccinated. Pag naging grupo talaga yan, meron at meron magkakaroon ng COVID. Kasi kids, they pass respiratory viruses from each other. COVID is going to be part of one of the respiratory viruses talaga. Ngayon, they go home. They live with their lola and their lolo. And their lola and their lolo did not get vaccinated. Kinikilabutan lang ako. The kids will probably be okay because ang tama naman ng COVID sa kids is really relatively minor. So that is really one of the reasons why we would like to vaccinate kids kasi nakakahawa po sila to the more vulnerable members of their family who may not be vaccinated. So kung kayo po ay isang senior lolo and lola, pag-isipan niyo po yun, you might not be able to be seeing your apos or you might be advised na wag pong magkita sa mga apo kasi pag yung mga apo po na COVID and it's highly possible, kayo po magka-COVID din and nako, serious po yan para sa seniors. Okay? So we'll cap this at our next to the last question na po.
Yes po. From Miss Cindy Abines Cantillo, hello po. Gaano katagal at kailan ba dapat palitan ng face mask? Thank you.
Ma'am, ako one of the things kasi, in the beginning of the pandemic, I did not change my surgical mask. Kasi talagang kulang naman ang mga mask ngayon. Noon. Pero ngayon, marami na hong masks talaga. So, I change po my surgical mask every day. Kasi po talagang, I am starting to really suffer po from mask knee. Dahil po, syempre, summer, we sweat into our masks. Talagang, nagiging siya talaga ng pawis. So talagang nagkakaproblema po ako with mask knee under my chin. And my dermatologist told me talagang sa mask yan, Ana, wala kang magagawa. Palitan mo na lang araw-araw. So I do that po. Those are the surgical masks because we cannot wash them. Yung cloth mask naman po, we can wash them. So pwede po nating palit-palitan yung ating cloth mask. And another reason why we should use face shields, majority po, we know that the surgical mask is better than the face mask. So majority po ng Pilipino talaga naka-face mask. So it's really better na tapalan pa po ng face shield, lalo na po pag nagsisiksikan o nasa loob po ng isang unventilated, yung walang hangin po na lugar o aircon na lugar. So try to wash your mask frequently kung cloth mask. Kung surgical mask po, you could reuse it a few times. Wala naman talagang Kaya lang, kung talaga marumi na po, then it's really time to change. Or if you are suffering like me from skin problems po due to the mask.
That's all that we have po, Doctora, for today.
Okay, so last word po, no? I would suggest po that we continue to use face mask and face shield kahit na po bakunado, especially if you do live in Metro Manila. If you live outside of Metro Manila in an area po na low talaga, you may elect po na wear a face mask. But lalo na po if you're out of doors. But again, if you were to ask me sa pangkalahatan po, it's still safer to wear a face mask and a face shield. And kung gusto niyo pong matigil na lahat itong bit-bitin po natin at hirap-hirap pong isuot na face mask and face shield, tayo po ay dapat magpabakuna lahat. Maraming salamat po and Maya Pabengi po, Kekongan. Thank you.